Hey everybody, this is Brett, and you are looking at the leg of a client that I'm working on right now. And she's been coming to me at least a couple of times a week for the last month and a half or so. And when she came to me, she was on 8 or 12. How many Oxycontins were you on?
At least 12 a day.
At least 12 a day. And a patch. What kind of patch was it?
Fentanyl patch.
Fentanyl patch. And so we've got her down to anywhere from 1 to 3 oxys a day and no patch, with just doing massage therapy. And the problem that she was having was a lot of pain in her legs. And I work on her legs, and they are full of knots. And this has been a chronic problem in her back and now her legs for her entire life, really. And so we've been working on her knots on her legs, and she is, grimacing and crying out in pain because there's so much nerve damage and tendon damage, swelling, inflammation. And you can feel it in there. It's just brutally swollen.
Oh.
And she was just telling me what about her kids that they'd... Go ahead and tell us.
They would touch me and it would hurt.
They would just touch you like that, and you'd go, ah!
Right.
And I was just saying to her that if I went like this on your leg, if there were a doctor, a medical doctor here, and I went like this on your leg, and it hurt like it does, I wonder what his diagnosis of that might be. And now you've been to how many doctors in regards to your leg problems in the last couple of years?
Dozens.
Dozens of doctors.
Neurologists.
And neurologists and what?
The Mayo Clinic.
You went to the Mayo Clinic in
Jacksonville,
Florida. And what did they tell you?
Chronic pain, just learn to live with it.
Chronic pain, learn to live with it. And what else were you telling me?
That I'd probably be pretty close to being in a wheelchair within a year.
Wheelchair within a year. Okay, so the problem that I have diagnosed that she has, and that we have largely dug out of her, is that she is packed full of knots. Okay, this client is overweight, and her legs take the brunt of a lot of that being overweight. And when your muscles are building lactic acid, and that lactic acid doesn't move out, it doesn't move out of the muscles, then it just sits there and it makes them swollen and sore like this. And if it doesn't get massaged out, then it's just going to get worse and worse and worse. And then you go to a medical doctor or a chiropractor or whoever, that doesn't know anything about the truth about natural healing. And what are they going to fill you full of?
Pain medicine.
Drugs. Fucking drugs. What are they? Idiots. Fucking idiots. That's exactly what they are. These legs need a lot of massage, and this client needs to lose some weight and do yoga and start living a more natural and holistic life. And we're going to get all the shit out of these legs and get her completely off of those damn drugs that are burning out her liver and kidneys. And it's going to be painful, because that's how life is. No pain, no gain. That's how things work. It doesn't matter whether you're getting a divorce or changing your diet or getting massage on muscles that are all swollen and nodded. So thank you much for joining me. This has been another lovely episode of Natural Healing with Brett. Please subscribe, and we love you a lot.